It's important to appreciate what is the impact of iron deficiency, specifically in heart failure. And I think, as we all know, that iron deficiency is the most common nutritional disorder in the world. So it's a worldwide problem. It's independent of geographical location. It's both in the Western world as well as developing countries as well. And when it comes down to heart failure, both iron deficiency and anemia are fairly common. And the prevalence of iron deficiency in both patients admitted with acute heart failure or with chronic stable heart failure is quite high, ranging from anything between 24% to 73%, depending on which cohort you look at. And the reason this prevalence is so variable is because of lack of standard criteria for iron deficiency as used in the past. However, things have changed in the recent years, as we'll be discussing later on. And the most important thing to remember is that iron deficiency, both with and without anemia, is associated with adverse clinical outcomes, as we'll see in the next couple of slides. This was a study out of Poland for around close to 550 heart failure patients. And what was found was that iron deficiency is more common in women. It's more common as the advanced heart failure progresses, or more common in advanced heart failure stages, and is associated with higher levels of inflammation. And the iron deficiency, the prevalence of iron deficiency in this cohort and others have similar prevalence among both heart failure with preserved ejection fraction or reduced ejection fraction. So it's independent of LV ejection fraction in terms of iron deficiency. We also now know, and this is again reflected from multiple research manuscripts as well as trials, that iron deficiency prevalence increases as we move around the functional class. So as New York Heart Association stage goes from class 1 to class 4, iron deficiency prevalence increases in the higher stages. It has an impact on both heart outcomes as well as quality of life and other measures. As seen on this particular slide, iron deficiency has a major impact on mortality. It increases the risk of mortality multifold. When we look at patients with heart failure who have iron deficiency anemia, they had a twofold greater risk for death than those compared to non-anemic iron deficiency, and actually a fourfold great higher risk of death compared to those with or without anemia. So iron deficiency as well as anemia both have impact on survival, and it's important to recognize this impact on mortality in this cohort. It not only impacts survival and mortality, it also has a major impact on readmission and rehospitalization after admissions for acute heart failure. And again, this we'll be hearing later on in our recent clinical trial data, how that can be intervened on. In this particular trial, up to close to 700 patients of acute heart failure, the readmission rates in both absolute iron deficiency as well as functional iron deficiency was pretty high. And the readmissions were in both due to cardiovascular as well as acute heart failure causes. It also has impact on exercise intolerance, both endurance as well as maximum exercise performance. We know that reduction in exercise capacity is in parallel to decreasing iron saturation levels. Iron deficiency is associated with lower 6-minute walk test, higher NYHA functional class. We also know the peak VO2 is impaired in those with iron deficiency anemia. And specifically, iron deficiency is the more common denominator in patients even without anemia as well. And peak VO2 is impaired in this population. It has an impact on both endurance as well as maximal performance. How does this happen? If you look at the slide in the left panel, iron deficiency has impact on hematopoietic tissues, including erythrocytes, immune cells, and platelets, cause anemia, reduction in oxygen carrying capacity, and this in result reduces the maximum performance. On the right side, in the non-hematopoietic tissues, the myocardium, kidney and brain, and other organs, it reduces oxygen storage, it causes more anaerobic metabolism, mitochondrial dysfunction, and then this all accumulates in decreased or reduced endurance, resulting in exercise intolerance. So clearly it has an impact on measures which are very meaningful to our patients. It has impact on the health-related quality of life. This is again replicated in multiple studies, again and again, that iron deficiency and iron deficiency anemia combination has a major impact on quality of life in patients with heart failure. Intravenous iron repletion actually favorably affects patients' global assessment and improvement in NYHA functional class. And this has been again shown in multiple short-term clinical trials and with different IV preparations of iron. So for the first part, I would summarize that iron deficiency in heart failure is fairly common. Even though the prevalence is variable, it's quite high. Iron deficiency is associated with impaired exercise capacity and both endurance and performance. It also impacts quality of life and other meaningful endpoints. It has a major impact on readmission and rehospitalizations after acute heart failure admission. And then finally, it adds on a multifold risk in terms of mortality in patients with heart failure. So it is of importance to recognize iron deficiency and to replace iron therapy based on iron deficiency states.